Today we're going to talk about blood culture collection, how to correctly collect these blood cultures, and more importantly, how to prepare the skin for the collection so that we can get the cleanest sample possible and decrease our contamination rates. By the end of this presentation, each of you will be able to differentiate between aseptic and sterile techniques in regards to blood collection. You'll also be able to discuss the need for sterile collection of blood cultures. You'll also be able to discuss the importance of collecting blood cultures from two different sites. And you will also be able to adequately do a return demonstration of the correct technique for collecting blood cultures. As a department, we have set a few goals. First and foremost, we want to educate all the staff on the importance of decreasing blood culture contamination rates. We can talk about blood cultures and collecting them until we're blue in the face, but until everyone actually understands the importance of blood cultures, it probably won't get across fully. Next, we want to create a standardized approach for everyone to follow when collecting blood cultures every time. If everyone's following the same technique, then there's more of a chance that we're not going to have as many contaminated sites. Finally, we want to continuously decrease blood culture contamination rates in the emergency department. Sadly, our contamination rates right now are through the roof, greater than 4%, and we actually want to decrease those numbers, and we want to continuously decrease them because our goal is to provide the best care for every patient. So we are all very familiar with the term blood cultures, but do we actually know why they're important? We're going to discuss that in a little detail. First, blood cultures are important because they're the best diagnostic tool that we have as far as in and out of the hospital setting to determine if a microorganism is present in the bloodstream or throughout the body, which helps us treat illnesses. With the use of blood cultures and culture insensitivities, we can choose the right antibiotic for a patient. We can decrease infection and mortality rate by 20 to 30% with accurate blood culture results. It also decreases the length of stay for patients. Think about it, if we have contaminated blood cultures, we still don't have accurate results as far as what contaminant is causing the patient's illness, if any is. So we have to keep them longer to recollect blood cultures, whereas if we had them accurate the first time, it might have earlier discharges. And another one that we probably all don't realize is that it decreases the cost of health care. How many times have we started a patient on a broad spectrum antibiotic until we got the blood culture results back because we didn't know which antibiotic was going to actually treat their illness? If we got these blood cultures back without being contaminated at an earlier rate, then we could tailor the patient's care, which is going to overall decrease how much money we're spending on hospitalization as well as antibiotic and other therapies. So aseptic versus sterile. I know we probably all like to think that we draw blood in a sterile manner each and every time, but that's just not true. Most of the time we draw it in an aseptic manner. Aseptic simply means free from pathogenic organisms. For this, you would have just your gloves. You would cleanse the site with an alcohol pad. Whereas sterile means free from bacteria and other living organisms. For this, you're actually going to do a true sterile technique. You would not repalpate the site once you have cleansed it. Often you would wear sterile gloves and the site would be prepped with ChloroPrep or something of that nature and would be vigorously cleaned for a determined amount of time and allowed to dry before we ever inserted the needle through the skin. Biggest thing to remember, and sometimes hard to remember, is once we create that sterile field through cleansing, do not repalpate the site. That's only going to introduce more bacteria and organisms back into the site, and you're now only going to be aseptic, not sterile. And blood cultures need to be obtained from a sterile site. So I'm sure we've all been told that when collecting blood cultures, especially in the adult population, we need 2 separate sets of blood cultures from 2 separate sites that are collected anywhere between 10 and 30 minutes apart, depending on your department. But the biggest question is, why are we sticking the patient twice? Why are we opening it up to even a risk of infection because we're breaking that barrier more than just the one time? Well, part of that reason is so that we can obtain the accurate volume that we need for these blood cultures. Inadequate volume when drawing the blood can actually give us false negatives and false positives in our blood cultures. So we use 2 different sites to make sure we have enough blood to use as a sample. Next, we also use 2 sites to decrease the risk of contamination. If we draw it all from one side, it could be a contaminated site, and we might not know that, because if it said we had a bacteria present in all of them, then we would assume, oh, it's positive. Whereas if we use 2 different sites and it was positive in one set versus negative in another set, it would lead us to believe that there's contamination possible and it's not a true positive. One of the biggest things that we all need to remember, especially in these patients that are difficult sticks, is never to pull blood cultures from an IV site. This could actually contaminate the site. Even if you cleanse the site and make it a sterile site, you might have remnants of skin in that collection. IVs are typically larger size needles and catheters than a butterfly would be. Therefore, you might actually core the skin and put that into your collection site, which is going to contaminate it because the skin naturally already has things like staph naturally present on the skin. So we do want to stick 2 different sites and educate the patient while we're sticking them more than once. More often than not, it's actually going to end up being 3 sticks, 2 venipunctures for blood cultures, and then 1 for an IV site. But it is still in the patient's best interest to stick the patient twice and have 2 different sites for those blood cultures. When collecting blood cultures, just like any other lab work, each individual person might have their own technique. But now we're trying to standardize the technique for collecting blood cultures. First, you want to gather all of your supplies. Make sure you have your blood culture bottles, an alcohol swab, ChloraPrep, tourniquet, 2x2s, and tape. Next, you want to cleanse the top of the blood culture bottles vigorously with alcohol pad and allow them to dry. While they're drying, wash your hands. Apply a tourniquet above the potential venipuncture site and palpate the vein. Once you think you've found a pretty good vein, actually release the tourniquet. Keep in mind, never retouch the top of the blood culture bottles once they have been cleansed with alcohol and allowed to dry. This is going to just contaminate the site. So once you've found the vein for the potential collection site, I want you to cleanse that site with ChloraPrep, vigorously wiping in an outward circular motion for 60 seconds. At this point, we're going to allow that to dry. We're not going to blow on the site, fan the site, or repalpate it. That would only introduce more germs and organisms to the site and no longer making it sterile. Next, you want to apply the tourniquet just above the site that you've cleansed, again without recontaminating the site. One of the new techniques we're going to try is using sterile gloves. While we still do not want to repalpate the site, it leaves less of an error if we were to come in contact with the site before we puncture it. Without repalpating the site, use a venipuncture set to access the vein. We want to use a vacuum set to transfer the blood from the venipuncture site to the culture bottles. In the past, we've used 10 cc syringes to actually pull blood from the venipuncture site, but that actually can open the patient up for contamination as well. Maybe the 10 cc wasn't completely sterile. Maybe we touched the tip of it, something of that nature. Whereas if we use the vacuum seal, then it's going to stay more sterile for the entire process. Now that we have obtained our blood sample, what do? This is the easy part. We deaccess our vein like we would any other time, engaging our safety mechanism so that we don't have any accidental needle sticks. Next, we dress the site with a 2x2 and Coban or tape or a Band-Aid, whatever you have available, and ensure the patient isn't continuing to bleed. Next, we label the culture bottles with the patient sticker and include the date, time, employee number, and the collection site, whether it be left forearm or right hand, right wrist, something of that nature. And then you repeat the process for the next set of cultures. At this point in the presentation, you kind of should have a good understanding as to why we're changing to this new sterile technique and standardized technique. Our hopes are to decrease blood culture contamination rates throughout the entire department. Each month we have a listed set goal versus what we actually obtain, and we want to start meeting that goal and exceeding it. We fully believe that with this standardized technique of sterilely collecting the cultures and everyone doing it the same way every time, we can meet and exceed those goals. At this time, we're going to practice some hands-on training, and if anybody has any questions, we can answer them at this time.